Welcome to Healthy Aging with Annie.
Hello, friends. Welcome once again to another health talk. This is Healthy Aging with Annie. And today I'm going to be talking about low estrogen bladder in menopausal women, the causes, the symptoms, and also how you can cope with it and possible treatment. Now, a lot of women go through this, most especially during their menopause, during after childbirth. Low estrogen can cause changes to the bladder and also genitals, and this can lead to more frequent urination or incontinence. And treatment is also available to help with this treatment. So it is not a death sentence like most people will feel. It's something that you can manage and cope with. Now, estrogen levels decline during menopause, which we all know. However, they can also drop during other stages of life, such as after giving birth or while breastfeeding. So a decline in estrogen levels can come up at any time, at any stage in one's life. So today I'll be talking about the bladder symptoms and what can cause them, and also how you can cope with it and possible treatment. What exactly can low estrogen affect the bladder? Now, low estrogen can cause thinning of the tissue that lines the genitals, and also this can also result as a cause of menopause, painful sex, inflammation of in the vagina, and then bladder dysfunction. There are so many things that can cause this. There are so many things that low estrogen can make the bladder to have dysfunction. Now, let us look at a list of these low estrogen bladder symptoms. One of the symptoms is incontinence. Now, what this means is that people lose control of their bladder, and this can happen in any contents. However, one of the most common forms is stress incontinence. Yes. Now, this means that a person loses control of the bladder and there is pressure on the pelvic floor, such as when coughing, running, or laughing. That can occur. Bladder incontinence is one of the symptoms, and this makes one to lose control of the bladder. The second symptoms is urinary pain. Now, a person or anyone that is having this low estrogen bladder can have pain when urinating. If you are noticing pains when urinating or shortly before urinating or after urinating, now take note of this. If it is consistent, then you need to note it down so that when you go and meet with your doctor, you can discuss this with him. Now, there are some people that also notice that their bladder feels painful or full after urinating, or that they are unable to fully empty their bladder. Once you notice this, please do not hesitate to seek medical attention. Another symptom, the third symptom is overreactive bladder. Now, a person or anyone may urinate more frequently than usual or have difficulty in holding their bladder when they are in need to use the bathroom. So take note of it. This is as a result of overreactive bladder. Now, other possible causes of this, other symptoms of this low estrogen that affects the bladder could be vaginal pain, itching or burning, pain during sex, trouble getting lubricated for sex, pelvic organ prolapse. That is, this is when the pelvic organs drop down into the vagina, then bleeding after sex, painful vaginal dryness, changes in sexual response, and also frequent urinary tract infection. So you need to take note of these symptoms, and if you're having them, then you need to seek medical attention. Now, what causes these symptoms? Low estrogen can cause bladder symptoms by thinning the tissue that lines the vagina, and this decreases the elasticity and strength of the vagina and surrounding muscles. So you need to take note of that. If you're having issues of low estrogen, kindly meet with your doctor. And this can also reduce the muscles that support the blood, that support for the bladder, the muscles, sorry, this can also reduce the muscles that support the bladder and also related structure such as the urethra. So take note of these causes. Other potential causes can include, like I said earlier, pelvic organ prolapse. That is, this can obstruct the urethra and cause problems with urination. Then nerve damage also, and disorders of the nervous system. And then spinal cord injuries, obesity, since obesity puts extra weight on the pelvic structures. And then pregnancy and breastfeeding, medications and side effects. So you can see these are the likely causes of this low estrogen bladder. Now, how can this be diagnosed? Also, do not forget to subscribe to my YouTube channels so that you can always get notifications when I come online. You meet with your doctor and he will carry out some laboratory tests to diagnose if you are having low estrogen bladder. Now, a lot of women go through this, but they do not really know. So try and take note of your body, be the champion of your body, take ownership of your body, take details of those little things that you notice in your system, and you will have a healthier you. Now, treatment. What is the possible treatment for low estrogen bladder symptoms? There are lots of treatments that you can do. We have the hormone replacement therapy, we have the physical therapy. Now I'm going to talk about this physical therapy. This physical therapy has to do with the pelvic floor exercises such as the Kegels exercise, as well as exercise to strengthen the core, the muscles surrounding that area. So it's very, very important that you involve yourself in exercises. Another way also is changing urinating habit. Now, there are some simple changes to urination habits, and this can help to reduce the instances of incontinence. Okay, for example, with stress incontinence, you can urinate before exercising or before having sex with your partner. So take note of it. Others could be medication. Other ways of treating it could be medication also. Another way is diet and lifestyle changes. Now, maintaining a moderate weight, getting regular exercises, and also similar strategies can help to reduce pressure on the pelvic, the muscles, and potentially easing the symptoms. So find a way also to do these lifestyle changes, to cultivate this diet lifestyle changes into your life, and it will help you. Also, do not forget to limit your intake of alcohol and caffeine. If you can avoid it completely, wow, that would be nice. So try as best as possible to do all this, and you will find out that with time you overcome this bladder issue. Then the last but not the least, when all methods has been tried and nothing is working out, is surgery. And this can help to also control urinary incontinence or pelvic organ prolapse. So try as best as possible to try other methods before going lastly for surgery. Do not forget to subscribe to my YouTube channel. so that you can always get notifications when I come online. Now, how can you cope with low estrogen, um, low estrogen and bladder symptoms? How can you cope with low estrogen and bladder symptoms? All you need to do is to find a knowledgeable doctor. Go for doctors that already know about this and they can put you through. Another one is to get a diagnosis. If you feel you're having the symptoms and you're not sure, go for diagnosis, and then this can be taken care of. Another one, the third one, is to join a support group. Now, there are people who have dealt with bladder and other low estrogen issues, and they may have innovative solutions also, as well as ideas on how to go about it. So try to join a support group. Then the fourth one is to approach things holistically. Now, how do I mean? For lifestyle changes, you can make significant difference to your bladder symptoms, and then you need to try to experiment different strategies, such as these pelvic floor exercises in combination with medical treatment. There are some cases where you can also go for good supplement. There are good supplements with your lifestyle changes and exercises. It can help to also take care of it. There are good supplements that you can use to help you take care of it. Wonderful supplements that you can take with a lifestyle change, and this can help you take care of it. Another one is persistence. There are some people that I hear them when they say they have tried, nothing is working. No, you can't try and stop. You need to be persistent. You need to be consistent with it. And with time, you will find out that you overcome this, because menopause is a transition. Childbearing, breastfeeding, they are all transition. So for you to overcome this that did not start in a day, you have to be consistent. You have to be persistent with it, so that you will be able to overcome all this. So continue to be persistent, and you will notice that gradually the symptoms will go off. So the summary of what I'm saying is that bladder dysfunction is a common challenge, especially later in life and during times of major hormonal changes. And also, low estrogen bladder symptoms can include incontinence, overreactive bladder, and pain. So take note of your body symptoms. However, these symptoms are treatable, and like I said earlier, a holistic approach uses medication, supplements, lifestyle changes, physical therapy, or other interventions that may help to reduce them or help to also manage them. So do not forget to speak with your doctor if you're having any concerns as to low estrogen levels, or if you are experiencing bladder symptoms. Once again, do not forget to subscribe to my YouTube channels. Thank you very much, and see you again in my next lecture. Love you all. Bye bye.